Hey everyone, it's Dr. Hillary from Rangeline Chiropractic. I am here with my friend Dr. Amy. She is a naturopathic doctor in Fishers. Dr. Amy, tell us a little bit about you and your practice, and let's dive into some of our topics today.
Sure. Okay. Um, so I work in an office in Fishers, and I see patients on Mondays, Wednesdays, and Fridays. And a typical office visit with me, it can be virtual or in person. And an initial visit is always at least 90 minutes, usually closer to 2 hours, where I do a complete medical history and just get to know you. And then follow ups are scheduled usually a month later, and then as needed. And follow ups are 45 minutes to an hour, where we go over the homework that I've given you and just a more comprehensive treatment plan for you.
Nice. So tell us how you got into naturopathic medicine and what is it? Because I feel like there's a lot of terms thrown around, and I'm sure everyone here is like, yes, but what do you do?
Yeah. So it's kind of a fun story how I came to be a naturopathic doctor. So when I graduated the first time from university, I had a social sciences degree and I thought I might like to be a teacher. So I moved to South Korea and I taught English over there to kind of try it out. and um, one day, my dear friend came over to teach with me a few months after I had been there. And we were sitting watching TV. That we had two channels that were in English, and one of them was CNN, which I didn't like, and the other one played old reruns. We were watching Oprah, and she had all these women on, and they were all um, working in their dream jobs. And it was so interesting. Like a lot of them had made these changes to do what they really wanted to do. And Oprah said, ask the audience a question like, if I could snap my fingers and you could do your dream job, what would you want to be? And I looked at my friend and I said, I want to be a doctor. And then all this self-doubt came in, and I expected her to go and like she's so sweet. She was like, yeah, you'd be an awesome doctor. Go for it. Like find out what you have to do and go for it. I'm like, all right. So a few months later, I was on a trip to China, and it was so interesting. I went into a hospital, and there was a man there who was teaching us about acupuncture. And there was a group of us, and we were all holding hands. And somehow, and I wish I remembered, it was a long time ago, but he was putting electricity through his body and putting it through all of us. And he was controlling the electricity, it was going up and down until it went, he made it go so high that we had to let go. Like it hurt. Like, and
Wow.
so he was just teaching us about energy flow and chi and the meridians and everything. And then to see these Chinese medicine doctors working in the hospital, the patients were having acupuncture needles, and then they were decocting herbs right at their bedsides. But then they also had their IVs and their oxygen and everything, like modern medicine too. I
Mhm.
was like, wow, this is so amazing and integrative. And so I was just like, I need to know more. So a few weeks later, I called my mom, like, I think I want to go to medical school. And she was like, wow, your friend that you grew up with is going to the naturopathic college in Toronto. And I was like, what is that? And when I read about that, I was like, this is it. Like, this makes sense for me because growing up, I was never, my mom was never one to be like, you need the doctor, like, we need to go get a prescription or whatever. She was like, let's try this home remedy because I grew up in a small town. We didn't have naturopathic doctors there. We had a chiropractor though.
We're all over the place, Amy.
Well, there was only one when I was a kid in our town, but I did start going to him when I was a teen. So I did at least have some of that exposure to a little bit of alternative medicine. So yeah, and then so yeah, I when I moved back to Canada, I went back to school for my pre-med undergrad. courses. And then I got into the Naturopathic College in Toronto to do my 4 years there. And then I had a practice in Canada for a while. And then now I'm here in Indiana. So
I know. We've known each other for a few years, haven't we?
yeah.
I was excited to get you on today. Tell us like the type of patients or the type of like conditions that you see. So someone listening might say, oh, maybe I should contact her for that.
Yeah. So first of all, my ideal patient is someone who has a goal like me to live really well into their 90s or hundreds and not be decrepit and living in a nursing home and relying on things like, no, I want you to live long and I want you to live well. And I think that starts before conception. So I love when young women come to me, or even women in their 40s who are like, I'm ready to have a baby in a few months. And I'm like, okay, let's detox. Let's get your body ready. Let's like clean out, because we're just bombarded every day with toxins. So let's get your uterus ready for a healthy baby. And then from there, I love giving parents alternatives to help their children stay healthy. And then I love seeing women for hormonal issues. Okay. Fertility is one of my favorites because naturopathic medicine and integrative medicine works so well for fertility. And then of course, like perimenopause and menopause too, all those things that need support, and even men's hormones too, like the andropause and testosterone issues that happen later in life too. But
those
also,
hormones are just out of control for so many of us, aren't they? Everything you're listed is like hormone, more hormones for the men. Yep.
Yeah. Thyroid. I like thyroid issues. Well, I don't like them, but I like helping with them.
Yeah.
Alternatives. And then also any kind of gut issue, because naturopathic medicine, everything goes back to the gut, and starting with the gut. It's kind of like chiropractic. Everything goes back to the spine and working with the nerves. And it's just, we need to work on our guts big time. And then, of course, things that can manifest from that, even including some mental health, things like anxiety, depression, and things along that.
I bet you've seen a lot more of that lately. I feel with everyone being cooped up at home and not in control of our environment and our surroundings, and getting to see people. I'm sure that you've seen that kind of on the rise. I don't talk to people as much about that as probably you do, but I hear bits and pieces more, and I can just tell it in my own patients, right?
Yeah, definitely. Yeah. And I think everyone needs a team. Like I think everyone needs a chiropractor or a naturopath and someone to do body work too, like massage therapists, craniosacral therapists, and acupuncturists. And I think that's a big thing that's been lacking this last year too, is just therapeutic touch.
Yeah.
It's so important. And therapy too. I think everyone should have some kind of someone they can talk to through all of this stuff, because there's a lot of things going on and racing through people's minds, and there's a lot of information that people are taking in.
Yeah. The lack of touch. I definitely, as a chiropractor, I like to get my hands all over people, and I know I used to hug a lot more pre-COVID, and now I'm always like, do I hug you? Are we hugging? I'll just tap you on the back while you lay there and rub your back. But yeah.
Yeah. I definitely miss the hugging.
No, I know.
Handshakes too. I shook someone's hand last week and went, oops.
Don't touch the hand. So a patient that comes into you with a lot of hormonal issues, either whatever age range, male or female, are you doing like blood work, and are you doing a lot of like virtual, and then I assume you're sending them for blood work?
Yeah, we can do blood work. That's the most convenient. And then the more accurate would be the urine test, like the Dutch dry urine. Yeah.
I forgot I did one of those last year.
Yeah. And then also there's salivary hormone testing, but that's more for looking at cortisol and adrenal health. So
Okay.
yeah, so blood, urine, saliva. And then I love doing a stool test called GI map too, which looks at your entire microbiome. So that's another one I like. Yeah.
Yeah, you can tell a lot, can't you, from the stool?
Yeah.
Unfortunately, fortunately, either way you look at it. You're not testing it, you're just getting reports, so you're fine.
Yeah, I just have the box shipped to the patient and then they ship it back to the company. I just see the paperwork. That's fine.
I'm sure your practice has changed a lot, less in front of patients in a room setting. But how do you still see patients quite often in like a one-on-one setting?
Oh yeah, yeah, yeah. So definitely last spring was all virtual, and but slowly it's been building up again. I'd say it's probably 70-30 now of in person versus virtual
Okay.
appointments.
Okay.
Mhm, mhm.
Another big topic that I was thinking of would be working with kids with maybe attention disorders. I do work with a lot of kids also.
Yeah,
Mhm.
yeah.
I'm just thinking of things I hear about a lot with patients and like what's on their mind. Yes, the hormones, we talk about that all the time, especially with all the women that I see. But I also think that the kids and their attention and their issues at school from attention or on I hear more lately than I used to.
Yeah, yeah. And I see a lot of digestive issues with kids too, stomach aches and constipation, and then eczema, which is a skin issue, but for me, it's a digestive issue.
It's inflammatory, isn't it? You're right. I have seen more cases, especially when I look at people's backs, or they say like, "I've got this here. What do you think that is?" Okay,
Hmm.
yeah, you're right. I
Yeah.
have seen more of that. Okay, good.
Hmm.
And then, so your office is in Fishers, and you kind of moved there recently, I believe, or how long have you been there?
Yeah, I just moved there at the end of January.
Good. What a good start
Mhm.
to the new year.
Yeah.
And where's your office located, like approximately in Fishers?
It's right next to the library, the
Oh,
Hamilton
good.
Southeastern Library. Yeah, so it's right across from the park there where the farmers market is on Saturdays. Yeah.
Nice. That's so convenient. Okay.
Hmm. Hmm. Yeah.
What are some like general health tips that you probably tell all your patients that we can just get out there today for everyone listening? Like I know we could be on here for hours. We could talk about the GI system for hours. I'm sure both of us. But
Yeah.
let's not bore people. Let's give them some like practical things that you probably tell all your patients.
So, so definitely for women's hormones and I think teen girls who have started their periods and because they're just irregular and that's normal, but something that I really love is called seed cycling. Have you heard of that?
Yes, but I don't know why. Like it's just in the back of my brain, but I don't remember why.
Okay. So that means you follow your cycle, or if you don't have a cycle, you follow the moon cycle. And the
Okay.
first 2 weeks, you eat ground flax seeds and pumpkin seeds. And then
Okay.
the next 2 weeks, you eat ground sesame seeds and sunflower seeds. And so they're just shifting. So they're more phytoestrogenic and more phytoprogesterogenic. And so it's just supporting those parts of your cycle. Also,
Nice.
just in general, those seeds are just have a lot of health and nutrition associated with them, and especially the ground flats. If you're not sensitive to them, they help with shifting the estrogen pathways so that it goes into the good what the estrogens that we like and helps clean out the estrogens that we don't want around. So
Yeah, so the ground flax I find is easy to add to smoothies. What else do you like? How else do you use your ground flax?
so I have a recipe for flaxseed pudding.
Okay,
Yeah.
tell us
Um,
more, Amy. We're listening.
So that one you would mix the ground flax seeds with like a nut milk or an oat milk or something like that. And then you could add like date paste if you wanted it sweetened, or some cocoa powder. And
Mhm.
then, so you mix it up and you leave it in your fridge overnight, and then it thickens like a pudding. So then in the morning, you just eat it like a pudding.
Is it now? I assume it's because the ground flax like absorbs, right? And it makes it more gelatinous because I've noticed that before in smoothies and I think, what is
Mhm.
this like why is this tasting this way?
Yeah,
Okay.
yeah, definitely.
That's exciting. I never thought about that. I feel like I could really get the kids involved with some pudding as I could tell them that, right?
Yeah, a lot of people do that with chia seeds too. There's tons of chia
Oh,
seed pudding recipes. So just
okay.
replace that with the flax.
I
Yeah.
would assume the flax is more nutritional value than a chia seed, correct?
It has more of the lignans, which help with the estrogen pathways. So,
Okay.
yeah.
Wonderful.
They're both high in omega fatty acids.
Mhm.
Yeah.
Nice.
Yeah. So, yeah, just about every woman that I see, I suggest doing the alternating seeds for sure.
Okay.
And
As you
then,
were telling me about it, I was like, nope, that's not what I thought. So I'm glad
yeah.
that you explained it. Thank you.
Yeah. And then some other things that I want people to make sure that they're incorporating somehow into their days, some kind of deep breathing, meditation, even if it's only 5 to 10 minutes a day. Um, Deep breathing, meditation, journaling, if you like writing or writing down your thoughts, or if you're having a lot of racing thoughts, then journaling can be helpful. So, yeah. And then also, if you if you are having digestive issues, journaling your food for a week, or if you're having headaches or anything like that too, writing down what you are eating and seeing if you can make any connections is also helpful.
Yeah. I love
Mhm.
that. I've personally done that and recommended it a lot. It's a lot of work sometimes, but I feel like after a week, you're like, oh, I did. I wrote down everything, and you can start to see some patterns, and then you can keep going.
Yeah.
Love
Hmm.
it. Well,
Yeah.
thank you so much for being on today. You have so much information. I love the seed cycle. Everyone that's listening, if you want to reach out to Dr. Amy and set up some time to talk to her more about that, that was really interesting. And making some flaxseed pudding. That was a bonus today. I didn't know we were going to talk about. I'm all on board with that. But we'll post your information under this. That way people can get in touch with you. But Dr. Amy Tweedle's in Fishers, Indiana. Do you have a name for the clinic? I forgot to ask you about that.
So my business name is Naturopathic Roots, but mostly like my website is just dramytweedlend.com. And
Okay.
my email is dramytweedlend@outlook.com. So that's,
Okay.
yeah, mainly what I am using to find me.
Wonderful.
Yeah.
Thanks so much for being on and sharing those tips today.
Yeah. Thanks for having me. It was
Yes.
fun.